Good evening, everybody. Welcome back to tonight's live discussion. Tonight we have the privilege of inviting Dr. Kassie Dewitt for our discussion about the leaky bladder. So with no further ado, I'm going to invite her so she can join us on this call. Okay, 1 minute. So thank you for everybody that is already joining us. Hi to everybody. I'll just give you all a wave. And while we're waiting for Dr. DeWitt to join us live, let us know where you're from, where you're listening into. And if you have any questions, leave them below so that we can get to them if there is time. Let's see. I hope this is going to work. Oh, come on. Okay. Let's see if we can. I'll quickly jump up here. Yeah. 1 second. Oh, yay! I was just getting nervous.
So nice to see you.
Yes, nice to finally meet you.
Yes. Oh, that made me nervous. I was like, why is it not going through? I'm here.
Oh, don't worry. You
got it, right?
It had to test us, right?
That's right. It absolutely did.
I luckily went to pee before I started.
Oh,
Otherwise, my bladder would have been properly nervous now.
If you saw my stories this morning, I talked about how I always get nervous for these. And it's not that anytime I do a speaking engagement, and it's not that I don't know the material or I'm nervous and I'm going to be stumped or anything like that.
Yeah.
It's always that fact. What if I need to go? And I can't leave in the middle of this, right? So what if I need to go? So that's something I teach in all my, things that I offer is being really cognizant of your bladder's function and when it's just being fussy or when it really needs to empty.
Yeah. For me, every time before a live call or something, it's like 2-3 minutes before the time. I become anxious and I'm like, okay, let me just first run to the bathroom because if I'm going to sit here hour and a half, I can't go and it's just going to get worse.
Right. Yeah. And so much of that is our nervous system just being like the bladder sending this nervous anxiety feeling. And the nervous system is like, oh my gosh, what we're going to get into that. We can go into that.
Yes.
But that's just the nervous system being nervous.
Yeah, exactly. Exactly. Okay, let me quickly introduce you. And then I would like you to just tell us a little bit more about yourself. But I would just like to introduce you guys to Dr. Kassie Dewitt. She is a doctor of occupational therapy who specializes in pelvic floor health and pelvic floor rehabilitation. She has a master's in post-professional doctorate in occupational therapy. She treats a variety of pelvic floor dysfunctions, including mixed incontinence, urgency, stress incontinence, which was just me. No, luckily not. Almost. Almost. Pelvic pain, pelvic organ prolapse, prenatal, postpartum mothers, painful intercourse, a word that I don't want to pronounce right now, vulvodynia, fecal incontinence, constipation, male pelvic pain. And her goal is to provide an integrative approach to pelvic dysfunction through the musculoskeletal system and restoring function with holistic treatments, which is my favorite part. And then she is a mother of 4 beautiful children with the youngest one of only 3 months old. And I had the privilege of seeing all the photos through the last couple of months, which I absolutely loved.
Yes.
So Dr. Kassie, please, if you have something that you would like to share with us of who you are, how did your love for this become or start, please just share a little bit about yourself.
Of course. So I did all that education because of my experience with urinary leakage, urgency, frequency, nighttime wakings, prolapse by the age of 19. I was diagnosed with a bladder and rectal prolapse by the age of 19. I had constipation. I had hip pain, back pain, pelvic pain way before I had children. I didn't have children until my mid 30s. And all of this started at the age of 16, really when I was considered a late bloomer for my menstrual cycle. And that is when, I don't know exact dates, but that is when I feel like there was a big connection to my urinary leakage. So the first time I had urinary leakage, that is a memory, a core memory of mine. I was serving a volleyball at my high school volleyball, and as soon as that ball hit my hand, I full bladdered emptied in front of an entire auditorium of people. Now, of course, people weren't like, "Oh wow, she just peed in her pants," but I felt at that moment that's what everybody was thinking around me.
Yeah.
So then years, of course, I go to the doctor for this and was given all these different interventions that, to say they weren't helpful to me now is an understatement. They weren't helpful. They didn't move me in the right direction. And it was honestly because I was asking the wrong person. I didn't know any better. I was at my OBGYN's office. I was at my primary care physician's office. And they're just not trained in pelvic floor rehabilitation. Their job is to put you in touch with someone who is a pelvic floor therapist. So even though our doctors are really knowledgeable about a specific area, for instance, our OBGYNs, they know so much about the pelvis and the organs that sit in the pelvis. How to rehab those musculature structures and train bladders might not be their area of expertise. That's when they would direct you towards a pelvic floor therapist that needs to be an OT or a PT. So that is kind of how I got started. I went through, do more Kegels, drink less water, never skip a bathroom. Like if you pass the bathroom, make sure you use it. This is normal for women. You're getting a head start on womanhood. I mean, I have told so many different things, did medication, had surgery. And it wasn't until my sixth or seventh OBGYN, he looked at me and he goes, "This is way out of my scope of practice. You need to see a pelvic floor therapist." And it was the first time that I had even heard of this. So when I met my pelvic floor therapist for the first time, I thought she was absolutely nuts. Because I had done medication, I had done surgery, and nothing like that, nothing had happened. And those are such invasive interventions that you think the more invasive, the more likely it is to work. And so when she was like, "You're going to breathe today," I was like, "You're nuts. Like breathing is not going to fix this." And she stopped me right there and she goes, "I need you to trust me. I need you to trust the process because everything you have been told in the past, I want you to get rid of out of your head because it's not true and it won't work." And I was like, "Oh, it hasn't worked yet." So, yes. So that's a little bit about my background. And once I stopped leaking urine and I became really empowered by my pelvic floor and bladder, and I was no longer embarrassed, shamed, any of those yucky feelings, I was like, this is what I was put on this earth to do, like a full purpose professional. When people ask me what my purpose is, my thought first is obviously my children, right? But professionally, my purpose is to empower women and support them in their body functions in an area that we don't talk about because it's like we don't talk about that area. So that's a little bit about myself. And that took a lot of education, right? Like I couldn't just because I'd been through it. I still needed an occupational therapy degree. I still needed to get the extra education for being a specialist in pelvic floor rehabilitation. And so that followed.
Yeah. I find it interesting how most people have a story behind why they are doing what they are doing.
Yeah.
And it's because they went through something.
Yeah.
They saw what didn't work. They saw what worked, and
Yeah.
that empowered them. It gave them a mission.
Yeah. I think those are the best practitioners.
Absolutely,
I
because
do.
they have the empathy.
They do. They can say, "Oh yeah, I've felt that. I have heard that.
Yeah.
I have said that to myself, but I'm telling you on the other side of this, there's this opportunity."
Yes.
You know? So, yeah, I
Yes, and
totally
through
agree.
your entire practice, you have the privilege of communicating hope, not just by what you've seen work, but what you know works.
Yes. Yeah. Yeah. So, like, for instance, when my therapist told me, you're going to breathe, and I thought she was crazy,
Yeah.
that is the first thing I teach my patients. And I say, look, I get it. It sounds nuts,
Yeah.
but let me tell you the science behind it. And let me tell you how it works and why it works and what
Mm.
I'm trying to do. I think that's so critical as practitioners is to people feel empowered and can make informed decisions when we educate thoroughly, right? When we
Absolutely agree.
say this works
Yes.
because this, and this. Not
Yes.
just I'm throwing spaghetti at the wall and hopefully one thing sticks, right?
Sticks.
Yeah,
Yeah, yeah,
yeah.
yeah. Okay. Well, with no further ado, let's get into the questions.
Okay.
And whatever you want to communicate, as much or as little as you want, feel free. The platform is yours. You have been invited to educate us. So I will start with the basic questions and we'll take it from there.
Okay. Before we
Okay.
start, do I
Yeah.
hit share video now?
Is it possible? I don't know if
So
it,
share
I've never
this
done
live
it.
video with others so they can watch too. I'm gonna
Okay.
hit it and see what should I
Go.
hit it?
Go for it.
Uh, I don't know. Okay. Okay. We'll see. Anyway,
Okay.
I hope it
All right.
pops up on both of ours. I should ask my husband if it's on.
Okay.
Okay, let's get started.
Okay then. Okay, so can you tell us what is the pelvic floor and what is its function?
Absolutely. Love this question, and I never miss it. My kids play with this pelvis. And they rearrange the organs in it. Um okay, so here is a pelvis, right?
Okay.
And we have our hips. This is the front of the pelvis. This is
Yeah.
the back. This is where our spine is,
Fine.
right? So the hammock of pelvic muscles down here that goes from pubic symphysis all the way to our tailbone and
Okay.
from side to side our sit bones. The pelvic floor is like a hammock of musculature and it's 3 layers deep. And each layer of that pelvic floor structure has quote functions that all works together, but it can be broken down a little bit into functionality. So like this first layer, so here we have the clitoris, the urethra, this is where urine comes out, this is a vaginal opening, and then this is our bottom anus, this is where poop comes out. So when we have this first layer, this like beautiful triangle, right? This is our first layer. It is in charge of sexual function. So
Okay.
anytime we have pain or discomfort or when we get perimenopausal, postmenopausal, where orgasms are harder to achieve or urinary leakage gets worse, that's more second layer. But we really pay attention to this first layer of musculature. It's also one of the hardest to contract and feel, but we also have to care for these structures with how we eat, how we drink, what we put against this tissue, right? So, in fact, my reel today was all about how to care for the vulvar in terms of quote cleaning it. So we can go over that later. So that's the first layer. The second layer is going to be like in here, and it's
Yeah.
going to be the layer that is more in control of urinary function. So if we're leaking urine, I tell my students anytime urine leaves your body without permission, that is
Yeah.
incontinence. That is not a normal function of the pelvic floor. You will
Mm-hmm.
never find anywhere in research that says it is normal to leak urine at this age or at this point of life or after
Yeah.
this many children. Now, there are things that can cause trauma to the pelvic floor, and one of those
Mm-hmm.
is vaginal burst, but also
Yes.
C. I'm a mom to 4 C-section babies, and there's a ton of trauma that goes through there. There can be physical trauma, emotional trauma, and all of that can kind of manifest in these layers of musculature. And then there's the deep, deep layer, and you can tell a huge difference with these layers compared to these structures. I call these tiny but mighty, because if they don't want you in there, you ain't going there. And these are the like jocks of the high school, right? Like they want to do so much work, and they help support all your organs inside. So this little bowl, right? This little bowl right here supports our bladder, our uterus, and our rectum. So the pelvic floor is urinary function, sexual function, support all those organs, keep them up where they're supposed to be, help stabilize the hips and spine, and also work with blood flow. So blood flow, muscles are fed with blood, and that brings nutrients to the muscle structure so it can get bigger, it can get stronger, it stays healthy. It also helps move lymph fluid throughout the pelvic region, because there's a ton of lymph nodes down there. So all of it works together to do those 5 functions. So anytime someone says, oh, it's completely normal for this, it's normal to have pain after intercourse or after babies when you're intimate, it's normal to leak urine, it's normal for this. It's very common because we're not educated enough or well enough on how to care for it. So that's a very quick intro into what the pelvic floor is. It took me
That's
a little bit
fantastic.
longer to learn.
Yeah, well, I can imagine. Having to know the names of every exact thing.
Funny is I used to know every single muscle and every single nerve and vein that fed and all these things, and now I'm like, first, second, third layer, that's good enough.
Well, that's all what we need to know.
That's all we need to know, right?
Exactly. Okay, so let's go on to question number 2. What are the symptoms of pelvic floor dysfunction?
Yeah, so it can be anything from, and depending on each stage of life, and this is how I teach my curriculum, because what we might need at 22 is going to look very different at 62. And it's going to be just like, and I'm sure you teach the same way, is what our body needs in our 20s looks different in our 30s, our 40s, our 50s. So pelvic floor dysfunction it can go up and down, up and down, up and down through those years. And we have to change what we do depending on what the needs are. So pelvic floor dysfunction is like an overarching umbrella term, and you can have pelvic pain, pelvic organ prolapse, which means those pelvic organs are coming towards like rectal opening, vaginal opening. You can have urethral prolapse, bladder, rectal, uterine prolapse, vaginal prolapse. Like there's so many different things that can try to make its exit through any opening. Not to scare anybody, it's just really important to know
but
those
these
things.
things happen.
They happen. And when you're pushing a baby, and okay, so let's say for instance, I had a bladder and rectal prolapse by the age of 19, and people say, how in the world could you have had a bladder and rectal prolapse by the age of 19? And it's because I was constipated and I pushed so hard to have a bowel movement. And never one time when I went to any of my physicians, God bless them, I have great physicians, but nobody said, what does your diet look like? What are you consuming? How are you hydrating? Because if they would have known I lived in Taco Bell and I worked at Sonic and ate tater tots and did terrible things to my body, and that had a lot to do with my constipation. So you can have urinary incontinence, which means anytime urine leaves your body without permission. You can have stress incontinence, which is going to be your coughing, laughing, sneezing. And so often we make jokes about this, right? Like women have to cross their legs to sneeze or to cough, or we can't jump on trampolines after babies. We can't
I couldn't
exercise or
jump on one
run.
before babies.
So
I
when
used
we
to
have,
laugh about it, but I was so embarrassed about it.
yeah,
I was like, what, 16, 17, 18, and I realized I can't jump on a trampoline
yeah.
anymore. and I just like, oh, there goes my one joy in life.
Yeah. And jumping on a trampoline, it's like becoming kind of trendy right now because of how great rebounding is for
Exactly.
lymphatics and exercise and all the things. And women are like, how can I do that? I leak urine. And I'm like, oh no, we can train you to not leak urine during that
Yeah.
time. So that's stress incontinence. Then there's urgency incontinence,
Mm-hmm.
where that is when your nervous system is coming into play and you have a trigger of some sort. It's also known as key in the door syndrome. So when you, like for instance, my urgency was so bad, I would full bladder empty anytime I saw my gym door. So if I was leaving the
Oh,
gym,
wow.
I would see my gym doors and I would just leak. It would
Wow.
give me so much anxiety, and I've never been able to figure out why. Um, and so that is urgency incontinence. It's like where there's this overwhelming need to go to the bathroom and you can't control it. And sometimes you're not incontinent yet, but you become like this Olympic sprinter to get to the toilet, right?
Yeah.
And
So
there's
the difference between the two is one is so it's not when you are stressed and you need to go that is stress incontinence. Stress incontinence is when you actually put stress on the
impact.
organs.
Yeah. It's like an
Okay.
impact. I got a call. I don't know if
Yeah.
that disrupts. You gotta you have some kind of impact against your
Yes.
pelvic floor.
Okay. Cool.
So then we have constipation, pain with intercourse, chronic UTIs, so many. And then we also not treat, but help women through those different stages in life, even if they're not incontinent. But say once we hit perimenopause, menopause, postmenopause, we have got to look at caring for the tissue because estrogen, though, I always think of estrogen like this fun party girl, and progesterone is like the calming
Calming
agent.
one.
Yeah, the
Yeah.
like girlfriend, calm down.
Yeah.
But when we hit perimenopause and estrogen is like bing, 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 and progesterone is like, I am so tired of your BS. I'm out the door, right? I am no longer babysitting you anymore. When that happens, the tissue can change. And
Yeah.
learning how to care for that tissue is super important because that tissue helps support the function of the pelvic floor.
Exactly.
Yeah.
Exactly.
I'm
Okay.
sure I missed one, but it's just an overarching. If things aren't working down there, if there's pain, if there's discomfort, if there's incontinence, if there's inability to hold back gas, those things
Okay.
I would file under pelvic floor dysfunction.
So you mentioned something about hip pain and what was the other one?
Back pain or pain with
Yes, back
intercourse.
pain.
Mm-hmm.
Yeah,
Yeah.
back pain and hip pain. How would you know if those are associated with pelvic floor dysfunction?
So anytime, if you think about your core, it is a
Mm-hmm.
canister. It's like a pop can. So the top of the pop can is your diaphragm. The bottom of that canister is your pelvic floor. The front, the anterior part is going to be your abdominal muscles, and the back is your spinal muscles. And they all kind of work together in unison to help a really nice functioning person. So posture, hips, spine, they all kind of go together. And when you have hip and back pain and you go to PT, physical therapy, I'm an occupational therapy, but when you go to PT and you're like, my hip hurts, they need to be asking the question on pelvic floor. Like, are you
Okay.
incontinent? Are you constipated? Do you have any of these things? Because they're all tied together. Everything works together from top to bottom. Your feet
Yes.
can be involved with your pelvic floor. So when you have, say, right hip pain, it's going to pull on other muscles in that vicinity to help,
Mm-hmm.
right? Because these
Yes.
muscles aren't
They need to
functioning as good.
compensate for each other.
They need to compensate. So they'll ask their friends, hey, help me out. And so all of a sudden you have another group of muscles doing work they're not built to do,
Mm-hmm.
but they help. And so it just can cause dysfunction everywhere. So anytime someone, and PTs are going to ask the question if they're really good and knowledgeable in that arena. And I feel like someone who specializes in hips or in spine low back pain specifically, they're going to ask these pelvic floor questions, which can be a little off-putting. I'm here for hip pain. Why are you asking me if I pee in my pants, right? But that is all part of the function. It all ties together.
Okay, fantastic. Thank you.
Mm-hmm.
Okay, so let's see. Yes. So, did I? Yeah, no. Okay. So, what is the most common cause for pelvic floor dysfunction? Whether it's too tight or too weak, and what is the most common causes for the dysfunction?
Yeah, so there's things that can make it worse, and you're more likely to have it. Like the more vaginal bursts you have, the bigger your babies are. Then there's trauma and there's all these things. But let's talk about the women who don't have any of that.
Yeah.
And say they have normal births, they have normal sized babies. Maybe they don't have children yet. There's also a part of it is just poor bladder habits, right? So I talk about this heavily on my page because I think we think pelvic floor muscles, I leak urine, I need to exercise more. And when people do that, and they don't get better, they think they're just kind of like broken mess. And I'm like, no, no, no. You're just taking, there's a big pie and you're doing one piece. And that's not gonna work. So a lot of this is even from times we are potty trained, we pee just in case, we push urine out, we rush to the toilet, we don't empty completely, we're not in a good position and posture on the toilet, we hold our breath, we clench our butt cheeks, we suck in our tummies, we don't exercise our pelvic floor. All of those are going to lead to pelvic floor dysfunction. So when you're talking about, I hear so often women say, I want a tight pelvic floor. And I'm like, no, you don't. You want a strong pelvic floor. And you want a strong pelvic floor for you, not for any exterior things, right? So a tight pelvic floor is a group of muscles that doesn't move well. And for muscles to be strong, they need mobility first. And so when you have muscles that can relax completely and contract completely, we have a good functioning muscle group. So when the muscles are tight and they don't move, so if you think about your bicep, and if your bicep is here all the time, and then you're like, man, this, my shoulder hurts or my elbow hurts, we can think about hips and spine, and I leak urine and I have pain with intercourse, and you're like, I need to strengthen this muscle. So you just start like contracting away at this muscle. All you're doing is putting so much pressure on both these joints, and we're just making this muscle shorter and shorter and tighter and tighter. So first, that's why I say not everybody should be doing Kegels. We don't show up and do Kegels just because we're leaking urine. And I think that's such a common misconception. And there's all these products out there on the market that's like, sit on this chair and get 12,000 Kegels in 30 minutes and buy this device and use your phone app. And I'm just like, you're not a pelvic floor therapist. You're not being assessed by a pelvic floor therapist. You might not need to start with Kegel. So I was told so much to Kegel, 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 Kegel. So I did. And it made the situation so much worse, so much worse, so much worse, because I was making this muscle just tighter and tighter and tighter. So first we have to mobilize, making sure we can relax, open our vagina like a blossoming flower is how I describe it, and then be able to contract completely. So that's a hypertonic muscle structure, too tight.
Meaning too tight, yes.
Too
So
tight.
I have a question on that, just something as you were talking, I was just thinking about it. So I'm thinking from a nutrition perspective. Would that then mean that if you are either dehydrated, that would affect the muscles, that if you have electrolyte imbalances, a lack of magnesium, all of these muscles are affected because these are the nutrients muscles need in general, and I mean protein as well. So if you have a low protein diet, high sugar diet, low magnesium, or imbalances of potassium and magnesium and sodium, or even calcium, I mean, all of this will affect the muscles.
All of it. So we separate for some reason. When we think about building a bicep and we start doing that, or we want big glutes, we think, okay, protein and water and all these things. But when it comes to our pelvic floor, we don't think that matters. It absolutely matters for every single muscle structure from head to toe, your nutrition and your hydration. That is why I put it in my course as it's the longest module is nutrition, because I think it's something that is so
missing.
It's missing.
It is missing.
And here in the States, we are dictated if we're in clinic by insurance and what insurance will
I
pay.
can imagine.
And if I'm an OT, and I always say I'm not a dietitian, I'm not a nutritionist. I have gone to a lot of extra education to learn how food impacts the body, but I will never give like a diet plan or anything like this. But I can tell you how food and hydration helps build muscles and helps feed the muscles and helps hydrate the muscles. So good. I'm so glad you brought that up. Nutrition is critical for our entire health and wellness, right?
It is.
It's a fuel we put in our body.
Exactly.
I tell women, you wouldn't put diesel gas in an unleaded tank. But for some reason, the gas we put in our bodies, it seems like we don't think it impacts our function, our quality of life, all the things,
Yeah,
So
it's
true. Anyway,
absolutely true.
we could have
So
such a huge
just
conversation just on nutrition.
yeah, we can. But now that brings me to another point. Women who drink a lot of alcohol, I mean, that dehydrates you and all of that kind of things. I mean, so I can imagine how alcohol, especially, can affect somebody greatly, pelvic floor muscle wise, and also obviously it's a diuretic. So, and it will irritate the bladder as well. So, and especially if you're perimenopausal, menopausal, postmenopausal, when you lose that estrogen and then you also lose that mucus lining of the bladder, and then it just becomes a greater irritant.
I tell my women who are perimenopausal or menopausal, I'm like, you either choose sleep or you choose to drink, and because it's such a disruptor. It is a literal toxin that we're putting. Mind you, when I started this journey of my pelvic floor healing, I was an early college student. Like drinking and smoking cigarettes. I'm very open about my lifestyle. I was drinking, I was smoking, I was eating terrible things. And I had this horrible dysfunction. And it wasn't until my pelvic floor therapist, she was like, stop it. Like it is killing your body. And so alcohol is one of the top 3 irritants that we put in our bladder. So here's our bladder, right? And it's lined with this smooth muscle tissue. And smooth muscle cannot be strengthened or weakened. So often I hear women say, oh, I have a weak bladder. And I'm like, you just have weak bladder habits. And inside this is your bladder lining. And so when your bladder lining is inflamed, if you think about inflammation, like say you have a cut or just an area of your body, it's going to be inflamed, it's going to be red, it's going to be irritated. So anything that you touch against that, it irritates it more. And that body system is saying, get that away from me. So anytime you put alcohol into your system, you're inflaming the bladder lining, and then it's also a diuretic. So you're peeing more frequently. That bladder has to contract more to get that stuff out of it, and it fills up. It makes it so fussy.
Yeah.
The other 2 are carbonation and caffeine. And those 2, but I would say honestly, the number one thing when you're leaking urine to try, I used to tiptoe around this because people really like their alcohol, and I'm just not a tiptoer anymore. If you want to stop leaking urine, we have to get rid of the alcohol, at least for the time being, to see if we can allow that tissue to heal and to become stronger with our good bladder habits, good hydration. And then if you want to have a glass of wine or something a couple times a week, then that would be your decision to make. Because once you heal the bladder and then you introduce an inflammatory product, it's really cool to see how much it impacts. How bad it bothers. Yeah. Excuse me. So
no problem. Okay, so let's see. Does the nervous system play a role in the bladder, and how?
Oh my gosh, absolutely. The nervous system is going to be your parasympathetic system and your sympathetic nervous system, and they both play into how your bladder functions. So you have this fight or flight, which is going to be that urgency. I have to get to the bathroom right now. I'm going to pee my pants. But your nervous system isn't thinking that. Your nervous system is like, it is built to protect you from life or death. So your nervous system doesn't know if you're being chased by a bear or your bladder's just being fussy and wants to get rid of some urine. And so, when I have people who have urgency incontinence and they're told by whoever to do more Kegels, you could Kegel and have the strongest pelvic floor. And I've met people with 5 out of 5 pelvic floor, the strongest you can have, and they still are leaking urine from urgency. And I say it has nothing to do with the strength of your pelvic floor. And I don't want to say nothing. It has a small piece. It will always, muscular strength is always going to play a role. But it's your nervous system. So ensuring that you are caring for your nervous system, understanding your triggers. So water can be a trigger, front doors can be a trigger, having a conversation as simple as this one and as lovely as this one triggered your bladder, triggered my bladder, right?
Yeah,
so
exactly.
It's your nervous system just having a little bit more anxiety, but learning, saying, hey, I know my bladder is not full. That is a trigger for me. I'm going to do some deep breathing. I might do some tapping. And as I age, I get weirder and weirder and weirder with the things
Don't we
that
all?
I'm like,
We research so much.
like, gosh, she's so wacky now. I'm like, I know it's just going to get worse. Um, so learning how to constantly love on your nervous system and calm the nervous system. I believe wholeheartedly the anxiety I had as a teenager and how I held myself so like clenched, belly sucked in, butt cheek squeezed, constantly nervous, had such a significant role in my urinary leakage. Right. So,
Absolutely, I can believe that.
oh, yeah. So learning to tap and to breathe and maybe to meditate and read and learning to control and calm your nervous system, identify your triggers, calming your nervous system outside of those triggers and calming it inside those triggers. So often women will say, oh my gosh, my front door is such a trigger for me. And I say, okay, so sit in your car for a few minutes and breathe. Because as soon as you walk through that threshold, now we're mom, we're wife, we're whoever, right? And that changes, and that can provoke a lot of anxiety. Your children can provoke a lot of anxiety when you come home, and that's okay to say. Love my kids more than anything. But I know going from work to home, there's this transition piece that I have to be okay with.
Yes.
Yeah.
Yes. Okay, so on the nervous system part, I think from a nutritional perspective, I think there is also a couple of things that we can consider to help relax the nervous system. Now, you've talked about the tapping and that type of stuff. But from a nutritional perspective, I think things that is important for people to understand is things that can play a big role is food sensitivities.
Yes.
Yeah, okay, so sorry, there was just no sound for a second.
Oh.
Okay, so no worries. So food sensitivities, food allergies, lack of B vitamins, like I said earlier, the electrolyte imbalances, also dehydration and omega-3s. So, and yeah, especially B vitamins play a very big role as well. So I think for people, if, if they have struggles, let's say with, anxiety, it is very important from a nutritional perspective, if you want to relax the nervous system, to make sure that you get the right nutrients in your diet so that your body is not going in that anxious state because it doesn't have the nourishment it needs to stay relaxed. Because, I mean, a lot of people will tell you it's mind over matter. But it's not. If your body cannot regulate itself, your brain can see, well, this is nothing to worry about.
Yeah.
You know what's going to happen. It's going to be okay.
Yeah.
You can try talk yourself out of it, but if your body doesn't have the resources
Right.
to calm itself, then there's
Mhm.
nothing you can do. Now,
Yeah.
I know when I was a mom of three young ones, so I had my kids really close together. I had 3 and 3 years.
Oh,
And
bless you.
yeah, thank you. I survived. So, I mean, there was a specific time where it was busy. And obviously, as a mother, you let yourself go and look after
Oh
everybody
yeah.
else. And oh, I'm not shy to say I lived off of sugar and coffee.
Yeah.
And that was my
Mhm.
survival. And when somebody introduced me to nutrition, the first thing I noticed, I was calmer. I can handle the stress. And that was just and at that stage, I only did one green juice a day. And it wasn't a lot of greens like this excessive green juicing that people are doing. It was just by adding a little bit of green to
Yeah.
something. And by just after doing that, I think for 2 weeks, 3 weeks, I started noticing, I feel better.
Yeah.
And so, yeah, I mean, it's small little things that we
Mhm.
can start to incorporate just to
Mhm.
make sure that we hydrate well, that
Mhm.
we get the nourishment that we need so that the nervous system can relax. Because in anyway, if your nervous system is relaxed, you're going to sleep better.
Oh, I can agree with you more. It's the analogy I go back to in the car. When you put the right fuel in the car, it runs really
Absolutely.
well. When you take
Yes,
care of the oil, when you take care of the fluids, it runs really well. Our body is the same way. It wants sleep, it
exactly.
wants nutrition, it wants sunlight, it wants just this calm atmosphere. So I couldn't agree more. And the strategies, tapping, breathing, all of those things are great, but if you're just fueling yourself with
Mm,
poor nutrition, it's going to impact the way you're able to cope. And so many people, right? And I know you hear this too. Well, life. I'm so stressed out right now. Like you did, like with babies,
yes.
small babies, you give and you give and you give,
Yeah.
and it's so hard to take the time for myself. Doesn't look like a nutritious meal. It looks like nu- Netflix in front of the TV, so I
Mm-hmm.
don't have to think about anything. I'm just like,
Exactly.
right? So I think it's so important that you bring this up, because life is never not going to be stressful.
Exactly.
Life's always going to be busy. There's always going to be I feel like right now my dad is very ill, and I lost my mom when I was 27, and now I feel like I'm going through the same thing with my dad. And the difference between that time and this time is I have so much better coping strategies. I fuel my body so differently. I am able to manage the stress, because though how heartbreaking and how sad this transition in life is, I know that if I don't show up for myself, I can't show up for him, and I can't show up for my kids, and I can't show up for my husband, and I can't show up for my business. And all of those things are really, really important to
Yeah.
me. So I'm so glad you brought that up. Nutrition is I don't do a lot of these lives. I don't
Mm-hmm.
do a lot of these because uh, I don't necessarily love um I love that you talk about nutrition. I love that your platform is about education on nutrition and well-being, and that is really important to me. So that's why I choose, when I'm going to do these things, something that truly impacts behavior and wellness and health, and that's nutrition is one of the biggest.
Oh, fantastic. Okay, so let's go on to the next question. Otherwise, me and you will chat
Talk
all night
forever.
long. Oh, for you, afternoon, of course. Sorry. um, all right. So for women in pre and post menopause, how does lowering estradiol affect the bladder and the pelvic floor structure? We touched a little bit on it, but if you want to go in more
Yeah.
detail, feel free.
So estrogen is our natural lubrication. It's our natural plumping agent, right? So as we hit perimenopause and menopausal women, and you know what's so funny is when I got out of pelvic floor, um, like certification, My ideal client was going to be the pregnant mama, postpartum mama, athlete. And that is not who chose me. The women who chose me were perimenopausal, menopausal, and postmenopausal. And I am so grateful that that is the route I went, because I absolutely love helping these women. And so when estrogen leaves the body, one, there was this study that was published in, I can't remember, 2001, 2007, and it absolutely terrified women from hormone replacement therapy. And I always tell women, I'm like, that was a really terrible study. And if you are a candidate for hormone replacement therapy, I think it's a discussion that needs to be open, right? I just had this conversation with my sister too. She's like, she is 10 years older than me, so she just turned 50, and she said, the doctor prescribed me estrogen cream, but the side effects just look terrible. It's like, try it. Just see how your body responds to it. And just see. So when estrogen leaves our body, lubrication drops, progesterone also drops, the plumping agent drops, and so that changes muscle structure. So now we can have vaginal atrophy. And if you look at the like labia majora, which is our outside lips, that of a 20-year-old and of a 50-year-old who's going through menopause, that skin structure has changed. And so much of that has to do with estrogen. So as we lose estrogen, the how our structures, our muscles, our tissues are impacted is vast. It's great. And so adding in a cream that doesn't stay, that stays systematic could be a place where you start, if that's more, or does it go systemic? Systematic. Sorry. Doesn't go my baby is crying, and it's just like, ooh.
Oh,
She's with dad, so she's fine. But
okay. But mom's heart is still
I'm like,
reaching out.
yeah.
I know the feeling.
It's like, okay, keep your train of thought. So estrogen cream could be a really great place to start. And it doesn't go systemic, which means it doesn't go throughout the entire body, but it can really help provide natural collagen again. When we lose estrogen, obviously our collagen is decreasing. So that cream can help provide more basis for creating collagen again, plump those tissues back up, help with lubrication. Because, one of the biggest things I hear from women is once they hit perimenopause or menopause is lack of orgasm and pain with intercourse. And it's almost like we have a whole nother life to live after that. We have years of living. So taking away something that provides so much good pelvic floor exercise, great hormones, happiness, quality of life, connection, it just hurts my heart. My favorite patient, not that I have favorites, but Sue was one of my favorites. She was 87 years old. She had never had an orgasm. She was pouring urine, had for 50 years. And of course, and she had a complete prolapse, meaning organ was outside the body. She had to use something to keep it inside. She was not a surgical candidate due to heart conditions. And so when Sue got to me, she was like, I've been told by everybody there's no hope. There's no hope. I'm too old. And I hear women say this in their 40s. And Sue at 87, had been struggling for so many years on every kind of medication, had tried everything. And she's like, I want to be intimate and I want it to not hurt. And I was like, okay, let's do this. And we just did all the things very holistically: nutrition, hydration, HRT, which I wasn't sure was going to help, but I think it did a little bit. And then also healthy lubricants, how to care for your vulvar tissue when you are leaking urine, how to keep the tissue dry, but also moisturize with good moisture, how to air things out, what to wear, what to do, how to strengthen, how to bring blood flow to the tissues. And all of that in culmination, Sue comes to me one day and she's like, Dr. Cass, that's what my patients call me. I loved it. Dr. Cass. Um, I had my first orgasm last night, and I like it still gives me chills.
Oh,
I'm like, oh my gosh, this is heavenly. And what was even greater was she had been married for 65 years,
wow.
and her husband had passed 5 years prior. And she was, or something around, I don't know exact numbers. I'm pretty sure that was it. But she had been dating her boyfriend for over a
Oh,
year. And it was
oh my
just, it
goodness.
was just incredible.
Yes.
And along, so with the creams, with the nutrition, with the hydration, with the exercise, with the good bladder habits, Sue never even used the toilet, which this was the first and the only one I've ever had in my profession. I've been doing it for many, many years. And she leaked urine so frequently, she didn't even know when she was going to the bathroom. Her bladder didn't signal that it needed to empty. So she never went and sat on a toilet because it was just always coming
Oh,
out.
wow.
And so there's such a culmination of things, especially as we age. And maybe you say, you know what, I'm not doing estrogen cream. I'm not doing that at all. I don't want to take any hormones or put hormones on my body. And I respect that so wholeheartedly too, because it's your body. And I love
Yes.
that. So what we do is then I educate. I'm like, okay, here's the lubricants that are safe. Here's how we wash the vulvar area. Here's how we strengthen, not just with Kegels, but hips and glutes and deep core. And here's nutrition side of it. And here's how we hydrate our body without overloading our bladder or dehydrating ourselves. Because a lot of times women are told to drink less water. Oh, you get up at night, don't drink water 4 hours
I've
before bed.
seen that.
So
Yeah.
bad. I'm like,
Yes.
or we could just teach them how to hydrate, and we could teach them
Yes.
how to hydrate with water and electrolytes. So maybe we're not consuming as much fluid ounces, or maybe we teach women how to not be obsessed with hitting a number. That's another thing I just went
Yes.
live in my community. Um, because I see so often New Year's resolutions are, I'm going to drink more water, or they join these programs and it's like drink a gallon of water, and then they live in the bathroom and they're having frequency and urgency and they're up all night. And I'm like, it's because your body doesn't need a gallon. Somebody's might need a gallon, but yours going from 20 ounces to a gallon, absolutely not.
Yeah.
We're not doing that.
Exactly.
It's not sustainable, and it's not gonna help other areas. So let's teach women how to hydrate well.
Yeah.
Let's teach women to be committed to hydration instead of obsessive about numbers.
Yes, no, 100%. And just a comment on that, something that I've tested myself and which worked great, is your cells can absorb more of the water if you have adequate potassium, magnesium, and sodium.
Yeah.
So if you drink, let's say, 1 liter or 2 liters a day, okay, now let's create a scenario. You have a deficiency of, let's say, sodium, potassium, or magnesium, and all of those kind of things, which your cells need in order to absorb the water. Now you are adjusting your intake of these nutrients, and now you drink the same amount of water, but you
Yeah.
go to the toilet less often.
Yeah.
So my husband also tried it. He used to always complain, if he drinks a glass of water, he needs to go to the bathroom. And then I said to him, well, clearly you need a little bit of electrolytes. So he tried it and he's like, oh, it actually works. I don't go as much anymore. So that is something I've heard over and over again when people say, I'm trying to drink water, but it just permanently keeps me in the bathroom.
Yeah. I think, I always think about the cells like closed. And
Yes.
all those electrolytes unlock that little door and that cell comes open.
Yes.
And then that water can sit in there and just hydrate and go to the places in your body it needs. I also get so often, oh, I go to the bathroom so frequently, or I leak because I drink so much water. And that's another misconception. We are made up of so much water. We need to drink a lot of water. So, but there's a way to drink it appropriately,
Yes.
or more efficiently. Adding a little electrolytes in there is great. Decreasing the diuretics, decreasing the bladder inflammatories, like carbonation, caffeine, and alcohol, and even acidity. So often women get, and I always hesitate to say this because lemon has so much good, does so much good for the body, but sometimes the acidity of some things can cause the bladder to just be fussy.
Yes.
So it's important to always like just test it out. We know carbonation, caffeine, and alcohol is going to irritate the bladder. So remove everything, do your electrolytes, do your hydration, do your water, and see how it goes. And then you can sprinkle in a little bit of that maybe lemon juice because we love a little, vitamin C, and it's also great.
Yes.
Yeah.
Yes. I want to back up a little bit. I want to ask your opinion about something. So, if women in perimenopause and menopause start losing estrogen and the tissue start to atrophy, do you think that using aloe vera gel can be beneficial, or is that an absolute no-go?
I don't know. I don't know. I've never so I use oh, my baby's crying again. Do you see my eyes and my ears kind of poke up? When so when women have, say, recurrent UTIs, I always tell them this supplement of freeze-dried aloe vera is so incredible. It kind of removes bacteria away from the urethra. It can make the bladder lining a little bit more robust. And it's a supplement. Love it. As far as how it goes with
I
menopause
was actually
and the
referring to
lack of
using the
estrogen.
gel as almost like a suppository.
Okay.
Yeah.
I'm not. I'll have to get into that.
Okay,
That's
well, I'll tell you exactly why I'm asking you this.
yes.
So a couple of years ago, when my hormones was completely ruined, and when I found my absolute favorite gynecologist in the country where I was living, she said to me, "Your hormones are imbalanced, and the way we need to fix it is through progesterone. Your estrogen is too high. We need to balance it."
Uh-huh.
And I said to her, "No, thank you."
Yeah.
And because, I mean, at that stage, I was like really stubborn about this whole idea. I'm 36 years old. Why the heck do I need to take hormones? And I was like, nope, 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 nope. And I went home and I started doing my research.
Uh-huh.
It took me a couple of weeks, and I went back to her. I said to her, "Okay, I'm ready to start it. I'll trust you on this, but I've got one requirement. It has to be bioidentical, nothing else."
Okay.
And in the country where I was living at the time, they had only one product
Okay.
that was bioidentical,
Uh-huh.
and it was a suppository.
Uh-huh.
My gosh, that dried up everything. It was like
Oh,
it felt like a desert inside.
oh,
And that at 36, I mean, that was awful. It
awful.
burnt, it hurt. Just going to the toilet to wipe was a painful experience.
Oh
It was
no.
inflamed and everything. And in my bathroom, I had 99.8% aloe vera gel. And I
Uh-huh.
thought to myself,
Why not?
aloe vera is good for
Yeah.
everything. I can't lose anything by trying.
Right.
And I used it. It worked a charm.
Oh,
It was
wonderful.
fantastic. Fantastic.
Oh my
So,
gosh, that's
so,
wonderful.
so definitely, if that is something that you feel comfortable with, from personal experience, when I was on that suppository, it literally overnight, the next day, it was, let's say, at least 80% better.
Wow.
Yes.
Okay. And you put it outside and inside?
Yes, I did put a little bit inside and on the outside. Yeah.
And no adverse reactions.
Nothing.
Interesting.
Nothing.
I want to look. I have a girlfriend who is super holistic and very functional medicine, and she knows so much about um every everything, I feel. So I want to run this past her, and I love learning new things that are from our earth that can
Yes.
be so helpful. And I think to myself, back then when I was taking these medications that dried out, I hate the term overactive bladder. It's like become a nemesis where I hear someone go, "Oh, but I have overactive bladder." I'm like, "Whoa." Um, my bladder was overactive because it was needing so much help. It was like dying for me to pay attention to it, right? And so I was taking this medication that's made in, and I'm not against medication. I am absolutely not against medication, but I feel like, why are we trying everything that is man-made if we can try something that is like within our body, or something that is from the earth, or something like that? I'm also not against surgery either, but I'm like, can we try the less invasive things first? And so in our country, I don't know, where are you located?
Well, I am living in Germany,
Okay.
but I am South African,
Okay.
and I used to live in the Middle East.
Okay. Wow.
So I'm a big
Moving
combo.
across country was a big deal. I was like, I used to be in Missouri, and now I'm in South Carolina. But here it's such a reactionary, and I don't know if you've seen that too, where it's such a reactionary medical system where we don't prevent much, we react to it. And the symptoms, there's this group of symptoms, and now we have a diagnosis, and that diagnosis lives in our chart for the rest of our lives. And we're given medical interventions such as medicine and surgery. And I'm not against those by any means, but I think they're in research, behavioral and like exercise for my area is where you start. But anyways, I lost my train of thought. So I like the aloe vera. I'm gonna look into that, and I will absolutely. Oh, when I was taking the medication, it dried out every part of me: my mouth, my eyes, my hair,
I've
my
heard about
skin.
that.
It's just, and of course it dried out my bladder because I was dry everywhere. So I love that. I love that aloe vera.
I quickly want to get to my notes that I made this morning, because I want the name of this specific doctor. She's a urologist, a very famous urologist in the US. Oh my gosh. And, sorry, I'm like far back. Found it. Let me see.
I was going to say Paul.
Dr. Casperson. Casperson. Casper, like Casper the Friendly Ghost.
Okay.
Casperson.
Okay.
Yeah, so I've seen her quite a bit online already. She also, I don't know if you know about this menopause documentary that is coming out. Mm-hmm. She is also part of that group, I believe.
Oh,
I think that's possibly where I kind of found her. And so, but anyway, so I listened to a talk that she did this morning. And she was talking about, she's a urologist, she does surgeries and all of that kind of stuff. And she specifically said, before you jump into surgeries, before you jump into medication, first line of treatment, go to a physical therapist and get your pelvic floor function properly. She said that was the first step that you need to take. Yeah. And then there was another one.
Indicates.
Say again?
That's what research indicates.
Yeah.
Behavioral and exercise first.
Yeah.
And then if we need to do something more invasive, we've tried it. We've done that. And I tell women who say, I have a grade 3 prolapse or a grade 4 prolapse. And I say, research indicates that is surgical intervention. That is, but that doesn't mean that is I always say we never do one intervention. We do a holistic approach, because if you throw one intervention, you never know how to not prolapse. Oh, yeah. You never know how to not prolapse. Again, you never know how to sit on the toilet differently. You're not learning to exercise. You don't understand how to hydrate your body. You're not paying attention to your nutrition, and you're never looking at your habits. And all of that is going to play into bladder and pelvic floor function.
Yes. Yeah, I mean, that is similar in the nutrition world, where people are saying, I'm going to go and do this diet for this purpose.
Yeah.
And then their body doesn't work according to that. So they don't achieve their goals because it wasn't what their body needed. You need to give your body what it needs. And if you're going to keep doing the same thing, expecting different results, well,
insanity.
Yeah. Exactly.
Yeah.
You have to learn to do new things in order for that training to take place, to retrain the body and to achieve the results that you are looking for.
Yeah.
And some things work and some things doesn't. And for one person it works and for another person it doesn't.
Absolutely. Something I hear so often from my women, like in their 50s or 60s, women were told to exercise more, eat less for, I don't know, years, right? Like cardio queens, limit, food intake, stay away from, anything that has sugar in it. I remember that, and that, sugar, I understand that fact, but it became such a shameful. I remember even as an 18-year-old girl being like, okay, I ate 2 cupcakes and they were like 350 calories a piece. So I'm going to run until I burn off 700 calories. Right. So it's something that's so misunderstood. And if you hear it 20 years ago, it's not going to apply to you now, no matter what it was. It's not going to apply to you now. Your body's in a totally different area and has a totally different need and needs support from a vast majority of interventions typically. Yeah.
Okay, perfect. All right, let's see. What are the most effective treatments for people who struggle with a leaky bladder? I think we kind of touched on that, but is there anything specific that you want to get into?
Yeah, so I always start my patients out with bladder habits. I never start with exercise. In fact, I just created an exercise guide. It took me 5 years to do this because I don't want women to ever think that if they just start exercising, all their pelvic floor dysfunction is gonna. It's like if you want to lose weight and you go to the gym every day. That's great. That's one piece of the puzzle, though, right? Sleep, hydration, food, nutrient based, whole food, processed food. Like there's a whole gamut to becoming the healthiest version of yourself. So, it took me. I was very resistant to that. And then I thought, if they're going to do anything, and that's the only thing they're going to do, then I will there's this exercise guide. But for my patients specifically, if you're going to work with me, we go through bladder habits. We're not peeing just in case, like I said. We're not rushing to the toilet. We're not pushing urine out. We're paying attention to our posture on the toilet. We're learning how to diaphragmatic breathe. The diaphragm, remember, is the top of the canister, and so learning how to move that way. You want your canister to move like a piston, so that coordination through diaphragmatic breathing, and it also calms your nervous system, is really critical. So I always start my patients with bladder habits, and it's one of the with exercise, as you know, it can take up to like 1,500 reps before you ever see any kind of, movement in the muscle structure, right? And people burn out a lot of times before that happens. So for my women, I want them to see small wins quickly. And I do this because, and it gives them this sense of control and power. And I think that's really empowering. And so when you make these small little like, okay, stop peeing just in case. Just do that one bladder habit, which is something we are taught when we are potty trained.
Since we are little.
Go potty just in case,
Exactly.
And I have 4 kids. I totally get that. Like, it's not that our parents did anything wrong. There's a convenience factor to it. But when we stop that one habit, and a habit is something we do every single day. So if you have to do it every once in a while, no big deal. But when we stop that one habit, and then all of a sudden you're like, wait a second, I don't need to pee. This is and all of a sudden you're like, this is an improvement. That gives you fuel to keep going and to change the next habit. And then you're like, I want to learn how to hydrate a little differently. And I want to learn the exercises outside of Kegels that can really help protect my organ systems and hips and back and spine, and have orgasms and not leak urine, not leak poop. That is something we don't talk about that happens very frequently, is leaking of bowel or not being able to hold back gas. So that's an important conversation for another day too.
It is. Yeah, that is. I mean, that's not something that one would think of. I mean, we women normally, it's common amongst women to leak urine.
Yeah, very much so.
But we don't so much talk about the bowel habits and
Yeah.
either the constipation or, like you say, if you can't keep it in.
Yeah. And this is something I suffered with during my pelvic floor dysfunction early on is I would leak feces and I try to bring so much light. I've got this humor about me. I like making people laugh. It was like a party joke. I pooped my pants on the way to this party, and it was 1000% the truth, but it was like this joke because it made me feel less bad about myself. But it's all right there. Like we are in close proximity of everything. So, and that as a unit, if that's not functioning well, then we can leak feces and talk about an impact on quality of life.
Yeah. And I can imagine that. I can imagine. So I assume this would be also something that would happen in men as well. I would assume this would also be something that would happen in men.
Oh yeah. So often I get people asking, okay, well, how do you train men? The exact same way. They have the pelvic floor. The only thing that I train men differently is with their urethras are longer than ours. So their urine. So I always teach my students, you want to make sure you empty a full bladder. We don't want to empty a half full bladder or a fourth full bladder. We want to empty a full bladder because we don't want our bladder to do any extra work, right? We want to go to work and do extra work and not get paid for it, right? So we don't want our bladder to do extra work. And so when gosh, I lost my train of thought. This is the brain of a mother who gets up 3 or 4 times a night with her baby.
Don't worry.
Sorry, what was
normal.
the question again?
No, if it's something that happens with men as well.
All you had to do was say men, and then I'm like, oh yeah, that's what we're talking about. So we want to empty a full bladder, and so I tell my women, I want you to count 1 Mississippi, 2 Mississippi, 3 Mississippi. Research indicates 8 Mississippis now is a full bladder. When I was first trained, it was 10, so that's what I still go with. Try to get to 10 Mississippis to know that we emptied a full bladder, obviously with no pushing or anything of that nature. Anytime you push urine out, you're pushing your organs out too. With men, to empty a full bladder, it might be closer to 12, 15 seconds. Now, if you go over that, that's fine. But I want you to, at minimum for women, 8 to 10 seconds, men, maybe even 15 to 17 seconds of urine.
Wow. Okay. Okay, great.
But they exercise, sexual function, erections, hip and back stability. It does all the same things. Very important for men to go through it too.
Perfect. I wanted to mention something else earlier while we were talking about perimenopause and menopause and that kind of things, and the frequency of UTIs that is so much more often in menopause and perimenopause, which is also because of the lack of estrogen and because everything is weakening, everything is atrophying and all of these kind of things. And do you maybe just quickly want to just explain why it happens? Because I think a lot of women, when they start menopause and these things start to suddenly happen, they don't make the connection as to why do I all of a sudden have all these UTIs?
Yeah. So again, we have care differently for our structures at this age and then or this time in our life. And so with everything, with estrogen leaving, lubrication leaving, we're not plumping, we don't have any of that plumping agent and things can kind of get I don't want to use any words that's going to make a woman feel bad about themselves, but the structures look and feel differently. And so a lot of the times though, when I see women having UTIs, they're leaking a lot of urine. Maybe they're having intercourse even though it's painful, which is causing maybe adhesions in there that's causing areas for bacteria just to seep right in. So ensuring that we're caring for the vulvar very nicely, washing with only water. We're only putting things against the vulvar tissue that are not filled with chemicals. We're using lubrications that are safe and healthy for us. But the other side of that is our gut microbiome, right? So like we have got to have a healthy gut to also ensure, which that changes as we age. So it's super
Exactly.
important to, again, take this holistic approach. If estrogen leaves, and if you're a candidate for hormone replacement, no, when estrogen leaves, it's not if, it will. If you are a candidate for hormone replacement therapy and it's something you're comfortable with, that's a conversation you have um, with your doctor. If you're like, no way, that's not the route I'm going, that is great too. And we just really ensure that there's so many different areas that we look at and make sure we're caring for that vulvar tissue as as well as we can. And when we're having, if intercourse is ever painful, no matter where you are in your life, it's not normal. And it's the way our body communicates with us oftentimes is through pain and smell. So if it's pain, that I want you to think of painful, I want you to think, this is my body is saying, hey, we need to talk. There's something going on, and never to ignore that signal. And then how can we make it better? Can we use a lubrication? Can we try different positions? Or can we always urinate after we have intercourse is a huge one. Is there a supplement we can take, like freeze-dried aloe vera, that pulls that bacteria away from the urethra? All of those things are ways we can help in that manner. Chronic UTIs is something that goes so overlooked, in my opinion. I will have women come in who have had, I had my first UTI ever in my life. I've had every kind of pelvic floor dysfunction, but I was so proud I never got a UTI. And then I moved my family across the country for no reason other than I wanted to see palm trees every day. And leaving my family was obviously
Yeah.
so
Stressful.
overwhelmingly stressful that I wasn't expecting it. I was like, oh, ocean and palm trees, here I come. And my body's like, actually, girl, it's gonna be hard. You're gonna be there with
Oh.
nobody, with three small children at the time. And I got my first UTI, and I cannot imagine looking at a woman in her eyes and being like, yep, this is okay. This is your 10th UTI this year. I just cannot, I can't fathom it. There's so many things we can do to help that. And if that doesn't work, then there's something called Eucora. I don't know if you're familiar with that can kind of flush the bladder. If you're a chronic UTIer, but we have to always get to the root cause. Like, what is causing this? This is an infection. We can't just keep taking antibiotics, because then we're messing with our gut microbiome so badly that there's no way we're not going to have UTIs from here on out.
I listened to Dr. Felice Gersh. I don't know if you're
Yes.
familiar with her work. Oh,
Uh-huh.
I love her. I
Yeah.
absolutely love her.
Yeah.
Anyway, so I listened to her explanation of why women in specifically menopause, postmenopause, are more prone to UTIs. And she explained that the moment that the vaginal canal starts to atrophy as the estrogen is leaving, then the where the glucose used to come out and all the fluids that kept the area nice and moist, now it cannot come out anymore. And so the lactobacillus, which is supposed to keep the environment acidic, die because they don't get the nutrients they need anymore. And then the pathogenic, the opportunistic pathogens from the anal area makes its way into the vaginal canal, up into the bladder, and then eventually it can also go to the kidneys. So that's how she explained it. So she says, from that perspective, she prefers ladies from the late perimenopausal phase, not the early one, the late perimenopausal phase, menopause and postmenopause, to definitely use vaginal estrogen to prevent that from happening. That will
Wow.
also,
Okay.
that prevents the bladder from chronic UTIs.
Interesting. I've heard the first part, but I haven't heard the second part where bacteria from the rectum.
Yes, yeah, she's specific. She said, no matter how clean you are, no matter how well you wash, no matter what you do, you're not sterilizing your body,
Right.
and they are going to find their way in
Yes.
somehow.
Absolutely. Interesting. That is,
Yeah.
I learned something. Yeah, I think for like I said, with hormone replacement therapy, I think it got such a nasty rap, and not everybody is a candidate for it, and not everybody is comfortable with it for sure. But
Yeah.
I think if you can do like a vaginal cream, an
Mm.
estrogen cream that
Yes.
stays right there
Yeah.
and helps improve your quality of life. Because if you think about it, some women can start menopause in their even 30s,
Yes.
that's more rare, of course, but when you
But I mean,
start
there's surgical menopause as well. For I mean, if you think of
absolutely.
the woman with endometriosis, which has everything removed.
Yes. Yes. That is actually another area. I had endometriosis. That was like the beginning of everything. And I had surgical intervention with that, and that changed, it absolutely changed my life for the better. But yeah, I think it's just so something that I don't want women to be like, absolutely not. I want you to do your research and learn about it. And it still might be an absolutely not. But think about quality of life and all the different measures we can do together to improve it. And so if you start your menopause journey in your 40s, you could have another 50 years. And
Exactly.
what does that look like? I always tell my
Exactly.
patients, I'm like, I want you to think about yourself at 8 years old, because of how women will talk about their bodies and talk about themselves. It's gross, washed up, broken, nasty. I mean, these are the things that women have told me or described their body as. So I always say, I want you to think about your little 8-year-old self. And would you tell her that her body was nasty? Absolutely
Oh,
not. And then I
wow.
want you to also think about your 80-year-old self.
Yeah.
When you say you don't have time in your 40s to spend 10 minutes on learning or um, making a nutritious meal, or honing in on your bladder habits, or exercising your pelvic floor, I want you to think about what your 80-year-old self would tell you, and
That's
what
true,
she
huh?
wants to still be doing at 80. Does she want to
Yes.
be home, independent, traveling, still intimate, driving a car, going out
Yeah.
in places, experiencing things?
Yeah.
Or
Oh, that
because
is
you did,
beautiful.
because you
I
didn't have
love
time in your
that.
40s,
Yeah.
now your 80-year-old self looks a lot different than what she really wants to be. So think about your 8-year-old self, and think about your 80-year-old self. And it goes
Yeah.
perfect for you too. Like, you always think about here and here, right?
Yes.
The two ends of the spectrum.
Yeah. No, I love that. That is beautiful. Okay, so um, the role of Kegel exercises, and should everyone do it?
No, I mean,
Good.
that's question. No, I think Kegels really help with coordination, and they bring blood flow. So, like, if you sit
Yeah.
at a desk all day long,
Yeah.
I want you to be contracting your pelvic floor just to bring some blood flow, right? And blood brings nutrients, right? Uh, but Kegling for the sole purpose of improving pelvic floor strength and stopping urine leakage, nah, so much better exercises.
And you also mentioned earlier, it also depends on, is your pelvic floor too tight or is it too weak? And if you don't know and you're going to keep on doing this, you can make things worse.
Yeah, yeah, totally. I mean, if you're contracting a pelvic floor that can't relax, you're making it so much worse.
All right. Another quick question on Kegels. Is there a right and a wrong way to do it?
100%. And that's the other side of Kegels, is that, and I have a free Kegel guide if anybody wants it. Okay, just message me. And I have a complete free Kegel guide because I want women to know how to do this. There's a front Kegel, back Kegel, global Kegel, right? And so often, whenever I was in clinic and I was doing a vaginal assessment, and I would say, I want you to contract your pelvic floor, people would bear down almost like they were delivering a baby, and they're like, oh, I'm kegling. We get so um uh discombobulated down there. We can't see it and we can't feel it a lot of times. So as we age, sensation decreases, so we don't know up from down there,
Mm.
right? So, and if you're never taught how to do a proper kegel, most likely, I mean, I want to say out of these thousands of patients I've seen, a handful were doing them correctly.
Wow.
So we want to contract the pelvic floor and lift. That's a Kegel. We're not just pumping away. That's great for
Mhm.
coordination and blood flow, but to really, a Kegel is front to back squeezing together and side to side. So I always say, like, think about picking up a blueberry, sucking up a smoothie, through your, which I saw a reel the other day of an exercise class. That's what they were doing. And I was like, what is my algorithm doing right now? Um, that is too
I
much
think
for
you just
me.
ruined my algorithm. I'm sure I'm going to see it now.
That is too much for me. I'm going to say it's too much for most people. So we want
I'm
to
sure.
squeeze and lift. So we inhale and our use our diaphragm, our belly expands, our ribs expand, our vaginal muscles blossom like a flower, and then we exhale and we lift, almost like we're zipping up a tight pair of pants. So that is a very quick how you do a Kegel. But I tell women, I'm like, I want you to work on the front Kegel, like you're stopping the flow of urine, which we never do during actual urination. That's not something we do. Um, or I want you to hold back gas. That's the back Kegel. And then I want you to combine them and lift. And I want you to do that without like turning your booty muscles on. It takes a lot of practice.
I
And
don't
it
even
gets
know if I can leave that.
frustrating.
It sounds complicated.
It is complicated, but if you think about it, just like, okay, I don't want to break it front and back. I just want to work on the global Kegel. If you sit on a yoga block because sensation decreases, if you sit on a yoga block and you have that tactile feedback from the other side, you're able to feel it a little bit better. And then you're like, oh, okay, I think I'm doing it. And then we want to work on holding it. And my girlfriend sent me a pelvic floor therapist on TikTok, and she was like, and squeeze, and squeeze. And I was like, I can't keep up, you know? So I always go at the wrong pace. Even for me, I'm like, lady, I can't keep up.
Wow. Okay.
Yeah.
All
Yeah.
right.
So
Okay.
sit on a yoga block, like straddle a yoga block and see if you can feel it better, or sit on your hand. That can help give
Okay.
you a little tactile feedback.
Okay. I thought I'm going to get away by saying I don't have a yoga block, but sitting on my hand, I can't get away with
Yeah,
it.
or roll up a towel. Oh, girl, I modify anything. We will find things for you to sit on.
Perfect. Okay, so let's quickly talk about specific foods that can affect somebody's bladder, irritate ones. Which are the most common ones? I think you mentioned three, right?
Yeah, liquids, carbonation, caffeine, alcohol, acidity can be irritating to some. Coffee gets a bad rap, and so often people think it's the caffeine, and sometimes caffeine doesn't bother people. It's the acidity in the coffee.
Ah,
So if you
okay.
go decaf and you're like, oh, it's not coffee, it still bothers me, I'd be like, let's take it a step further and just eliminate coffee completely. Dairy, gluten can be, you're looking at all the top 8 allergens.
Mm-hmm.
It's not just going to be sensitive to the gut. It's also going to be
Yes.
sensitive to other organs in that
Mm.
vicinity. So it's really important to, if you do have a sensitivity to food, of a certain food, look at the top 8 allergens. I always say start with gluten and dairy and see how it goes. And normally, once we're getting to that point, that's out of my scope of practice, and I'm like, let's go to someone who has a lot more knowledge on this.
Oh, perfect.
Yeah,
Okay. Right, let's see. Is there anything people can do at home to improve both their bladder and their pelvic floor, apart
absolutely.
from Kegels?
Everything can be done at home. When I took my practice from clinic to
Yeah.
here in home, I thought, oh my gosh, I'm not going to have my hands on my patients. I'm going to miss it so bad. They're not going to do as well. They do so much better. My
Oh,
patients have had such a better outcome
wow.
at home because they're doing the work. They're not having to go to a clinic.
Yes.
I'm not saying don't go to a clinic. I think that's great too.
Yes.
Always do how you learn better. So we're looking at our bladder habits. You do it home and you do it out in the community.
Mm-hmm.
It is not, we can't just practice. It's like going out to eat. Um, you don't just eat healthy at home and then just go totally haywire every single day, every time you go out to eat, right?
Mm-hmm.
You have to maintain this functionality and this lifestyle. So we practice at home good bladder habits, and we do it out in the community too. And then exercise, of course, all my exercises can be done, hip and glute and deep core strengthening can be done at home,
Okay.
And if you're like, oh no, I want to lift weights, I want to get stronger, I'm like, I can find anything in your house to lift. You don't even need a gym.
Okay.
Yeah.
All right. So, and when is the right time to see a pelvic floor specialist?
Um,
How do you know what? I mean, if some people will think, okay, I'm just leaking bladder if I sneeze or whatever. When is it time
if
to go see a
if
specialist?
urine is leaving your body anytime without permission,
Permission.
that is your body's communication. And she's my best friend. Like, she is carrying me through this entire life, and I will not ignore her communication. And so if there's pain, if there's odor, if there's recurrent UTIs, if there is inability to empty or constipation or anything of that nature, that's a really good time to talk to someone who has devoted their life to this specialty, right?
Okay.
So,
Okay. Perfect.
say you're pregnant. This is another big
Okay.
one. Pregnancy is an Olympic event that nobody trains for.
Yes.
And we get so much care pregnant wise. But we're almost waiting for the dysfunction to hit us instead of saying, what can I do while I'm pregnant? Or even before I get pregnant. And even when I worked in the hospital and I would talk to these doctors, they're like, well, why don't we just wait until she says she's leaking? And I'm like, why would we wait for that? Why won't we educate now to prevent?
Yes.
So that's something. And postpartum too, give yourself a minute to, I'm 3.5 months postpartum, and give yourself a minute to kind of come back down from 10 months, 9 months of pregnancy, delivery, surgery, whatever it is, and see where you're at. But your body 1000% needs rehab. So you can do it at home, you can do it in a clinic, but I'm telling you, those muscles went through so much trauma the past 9 months. It's advantageous to just learn a little bit about it. And
Makes
then you get
sense.
to teach
Makes
your
sense.
kids.
Yeah.
My kids know
Yeah.
more about the pelvic floor than I'm going to say most women do. I heard
Yeah,
my
I'm
daughter
sure of
tell my
it.
husband, or I heard my daughter who's 8 tell my son, my 6-year-old who has urgency, my little boy, just breathe, Henry, just breathe. You're the boss of your bladder. And I was like,
Oh.
yes.
Oh. Yes. So see, they have the privilege of growing up with the concepts.
Yeah,
And that's why they are, and also you've got all
sure.
these amazing toys and stuff that
Oh,
they can
yeah.
play with and put it
Oh,
together.
yeah.
And
They love all my stuff. Yeah.
I can
And
imagine
I,
that.
I think one of the things, as a mother, I want my kids to be so proud of their bodies, their capabilities, their abilities, and to never take them for granted and never feel shamed or embarrassed to ask the questions. And I think for so long, this has been such a taboo place to talk about, and it impacts our quality of life so deeply. So my daughter is okay with saying vulva. My son is okay with saying
Yes.
penis. Like, he can express this area of my penis hurts. And I'm like, okay, this is so great. Instead of like doing this dance. And I hope they never let go of how proud they are of their bodies and being able to have these discussions,
Yes.
because they know, like, oh no, that's not normal. My mom told me that's not normal. I need help, you know?
Oh, perfect. Yeah, yeah. Yeah, I mean, you're leaving a legacy behind.
Yeah, I hope so. I mean, I journal a lot, and one of the questions I was journaling the other day was, like, "Oh, what's your legacy?" And I hope so much that I leave a legacy of for my kids to show, like, sometimes talk about uncomfortable topics and always be there to support and be kind and to educate so people can improve their quality of life and never be embarrassed of our bodies. They are incredible, complex machines that if we just listen and care for them, they will work for us, right?
Yeah, awesome. That's beautiful.
Yeah.
Okay, so let's see. Okay, we got that one. Okay, please share about your online programs.
Oh, yeah.
And can anybody do it from anywhere in the world? I assume it's online.
Yeah.
So
Yeah.
should be possible.
Yeah, so that was a really cool thing, is being able to help people all across the world from
Yes.
different cultures, different experiences. Um, that has been probably the coolest thing about coming online. So I have an online course. It's my big one. It's called You're in Good Company, and it's going to take you from A to Z. We're talking anatomy, physiology, functionality, breathing mechanics, urgency, frequency, posture, exercises, self-care products, menopause, pelvic pain, pelvic organ prolapse. It is a big one. And that is something that's online, self-paced. Then I have a community membership where if you're like, okay, I don't want all of that, I just want you to educate me a couple times a month. And so I go live twice a month. And in that, there's a nervous system course, a ton of resources that you can go through as you want, or whatever you want to do. And that's where I go live and I go deeper into educating women on whatever pops up more often in the questions, so like this past one last week we talked about hydration. I've had guest experts in talking about constipation was our last one. We'll have a menopause expert come in, and that's that monthly membership. And then I have the pelvic floor planner, and that's 52 weeks of pelvic floor exercises. So those are my three offers. I have a free master class. I do so much content on Instagram
You do.
daily.
You
Yeah.
do. You do.
Trying
You
to
put some
educate.
really amazing content out.
Oh,
Thank you for that.
thank you. I do like producing content. Anytime someone, if I hire someone to help me in my business, they're like, "Oh, content." I'm like, "Oh, content's easy for me. I can talk about pelvic floor to a brick wall. I never need help with content. My job, my purpose is to create content that really helps educate women. So even if you know the online course isn't where you want to be right now, or cannot, whatever the reason is, there's so much content on my page that I hope that you can, pull something from it and start implementing.
Okay. So are you only on Instagram, or is there other platforms that people can find you as well?
I'm on Facebook too. I'm on TikTok for the time being. I know nothing about TikTok. I just heard it's going away, so we'll see that. But I'm on Instagram and Facebook for sure, and
Okay.
YouTube. I just started creating YouTube videos, so I created one. So we'll see how that
Oh,
goes.
perfect.
Yeah,
Perfect. Okay, let's see. Any last words of encouragement for anybody who's currently struggling?
that you're so not alone, and it's not your fault, and your body is so capable of fixing itself. If I could tell a woman anything, no matter what diagnosis they've had. I haven't just helped menopausal women or postmenopausal. I've helped women with traumatic brain injuries, Down syndrome, muscle diagnoses, MS, Parkinson's. There's so much we can do once we know what to do. So no matter what capability you have at this moment, just be encouraged that with a little bit of knowledge and education, you can make small little tweaks and quality of life can improve. So I think that I would just encourage women to not be discouraged by any of their diagnoses that they have faced.
And that there's hope.
There's absolutely,
There's always
I
hope.
mean, look at Sue, 87.
Yes.
Her
Oh, that is the most beautiful story ever.
her uterus is like outside her body and never experienced an orgasm, doesn't even use the toilet. And she went from 14 to 15 pads a day to one, just in case. She would not let go of that just in case pad, but she was going to the toilet regularly. She was having orgasms. I mean, and that's just one of, I've had over 3,500 students online, and I was in clinical practice for years before that. There's so much hope, so much hope.
Well, Dr. Kassie, thank you so much for spreading this word of hope and educating us. I really absolutely loved this discussion. Thank you for empowering women, and thank you, to show us which way to go. And I think because women is so embarrassed by this experience that they might be too shy to even talk to their doctor about it. So if we can, for this content that we are putting out there for them, that they can feel empowered where to go, who to talk to,
Yeah,
who to reach out. And if they don't want to go to the doctor, they can reach out to you and do your program.
absolutely. If you are embarrassed about anything, send me a message. I am the one who answers all my messages. I have talked to countless thousands of women, educating them on, you know, some women don't want to do online programs. And I get that. Like, I totally understand that. So let's work together and see what we can do. Maybe I can help you find someone, or if you're embarrassed or have a question, ask me. I'm more than happy to help in whatever way possible.
Okay, perfect. Well, thank you so very much. And go hug and cuddle that baby of yours if she's not sleeping at the
She's
moment.
sleeping now.
Well, I'm sure your arms are ready to receive her when
Yes.
she wakes up.
Yes.
Okay. Well, thank you so much for your time.
Promise.
I really appreciate it.
Thank you. I'll see
Okay.
you later.
Okay.
Bye.
Have a good day.
You
Bye-bye.
too. Bye.